As we know that industries cannot manufacture its products without the use of energy like electricity, etc. Likewise, these manufactured products cannot reach the market or consumers on their own and require suitable means of transport. Some essential services like banking and insurance facilities cannot be rendered without the support of effective communication. Without all these, an economy is unable to grow and develop socially. In view of above statements, one can easily deduce that electricity, transport, communication, health, etc. are the basic components of society and economy. All these components are called infrastructure elements of a country. Social development and economic growth of a country are prompted by these components. In this chapter, we will learn about infrastructure and its types, infrastructure and development, energy for economic infrastructure, health and hygiene for social infrastructure, energy as an emerging challenge, measures to check problems of energy, health as an emerging challenge, and measures to check problems of health. Infrastructure and its types. Infrastructure means an underlying base or foundation, especially for an organization or system of the economy, like as transportation and communication systems, water and power lines, schools, colleges, post offices, hospitals, and dispensaries. Infrastructure is of two types: social infrastructure and economic infrastructure. Infrastructure and development. Contribution of infrastructure to the process of development affects productivity, boosts up the size of the markets, establishes a network in production, promotes investment, promotes the ability to work, and facilitates outsourcing.
The state of infrastructure in India. Rural women still use biofuels such as crop residues, etc. to meet their energy requirement. Only 56% of rural households have electricity connection and 43% still use kerosene. Census 2001. About 90% of the rural households use biofuels for cooking. Tap water is available only to 24% rural households. Only 20% of rural population has access to improved sanitation. India invests only 5% of its GDP on infrastructure. Economic infrastructure.
Energy is the most important component of the economic infrastructure. It is required in all the sectors of production. Energy can be classified as commercial and non-commercial energy, conventional and non-conventional sources of energy, biomass and biogas, and primary and final sources of energy. Energy as an emerging challenge. Following points give us an insight into such challenges: insufficient electricity generation, transmission and distribution losses, losses incurred by electricity boards, underutilization of capacity. Measures to check problems of energy.
Increase the production capacity of thermal power stations. Achieve fuller utilization of the plant capacity. Reduce the transmission and distribution losses. Conserve electricity. improve energy efficiency, optimum utilization, extend life of old and inefficient generation unit, strengthen the transmission capacity available, social infrastructure, health and hygiene.
Health can be defined as a state of sound physical, mental and social well-being of an individual. A healthy person has sound mind with greater energy efficiency, thus enhancing productivity. Certain changes have taken place due to improvement in healthcare facilities, including increase in expectancy of life, decrease in child mortality rate, decrease in death rate, decrease in infant mortality, and control over deadly diseases.
Development of health services after independence. The country has a well-organized three-tiered public health infrastructure including community health centers, primary health centers and sub-centers. Healthcare facilities and personnel increased substantially between 1950s and 1980s. However, the number of licensed medical practitioners per 10,000 individuals had fallen due to fast population growth. The table provides the important statistics related to health services in India. Women's health. Following are some alarming facts related to health of women in India.
Health as an emerging challenge. Following points highlight the drawbacks in terms of health facilities: unequal distribution, poor sanitation level, communicable diseases, poor management, burning biomass is hazardous to health. Measures to check problems of health and hygiene, universal coverage of urban areas, improving the quality of health and education, identification and reduction of leakage and preventive maintenance, and integrated action plan.